everyone, thanks for joining me today. I'm here to help you chart the course for people's success with learning and performance. I'm Jeanne Bonzon with BJC Healthcare. I'm going to take you on a journey today. I'm going to tell you a little bit of a story. And that story is going to include the business imperatives, the why we're going down the journey. And it is going to have 3 points of view. One point of view is the employee. Another point of view is the leader. And then the third point of view, very important point of view, is what does the administrator have to do on the back end? So I'll also end up with what we've learned along that journey, and we'll start right now. Context. Got to set the stage, paint the landscape for you. And the first thing is about my organization. As I said, I'm with BJC Healthcare, which is a health system with 15 hospitals and an assortment of what we call service organizations. Service organizations might be things like our physicians group or our home care and hospice groups. So 15 hospitals, assortment of service organizations, and 32,000 employees. We're located in the St. Louis metropolitan area, so we're regional, but we are very diverse. Diversity includes, we have urban, suburban, and rural hospitals. We have an incredibly diverse employee base. Each hospital is its own, like, small city. It can run the gamut of jobs from somebody who is delivering their food trays to patients, to somebody who's doing genome research, to actually doing brain surgery. So our challenge in the Learning and Development Group is really to meet people where they are, wherever they are on that journey. So diversity. We are also nonprofit, and our mission is to better the health of the communities in which we serve. So that's that first paint on the landscape. Business imperatives. St. Louis isn't Houston. We're not LA, we're not New York City. We are a good-sized city in the St. Louis area, as I mentioned. And what's funny about St. Louis is that we actually have an incredible number of hospitals. BJC has 15. There are at least another 15 hospitals in the St. Louis area. So what that means is that we're always in a fierce competition for talent. Nurses can literally go across the street and choose to work at another hospital. So our business imperatives, our strategic imperatives, are attraction, retention, and engagement in the learning group. As you can see on this slide, in 2016, we had a little bit of an issue with retention, especially with our first-year employees. 1 in 4 employees who walked in our doors walked out before that year was over. Only 74% of the people at BJC recognized that BJC actually had long-term opportunities for them. And less than half of those people thought we were doing a good job of retaining our employees. So as, again, backdrop, this is the reason why our learning group, the BJC Institute for Learning and Development, started down the road. What's the road? We have a program called Guiding People to Success. It's an organizing framework. And that organizing framework has 2 pieces, as I'll show you in just a second. The 2 pieces are myGPS. myGPS is the employee side. As you can see in the middle, there's a metaphor of the road, which is why we're on this journey. myGPS is the organizing framework that organizes learning and development opportunities for all of the 32,000 people working at BJC. It's organized over time, over the life cycle of an employee's career. So it starts out at the top of the road in onboarding, that first critical year where we need to connect to the employee and have the employee connect to the mission of our organization. Then it goes into success in current role, success in future role, and then last is planning for retirement, which in essence is links to our retirement organization in the benefits group. On the other side of the road, you'll see Leader GPS. And Leader GPS is also organized in that same timeline, but Leader GPS is really about tools and resources just in time, whenever the manager needs it. Either one is intended to be a one-stop shop. So we push people to GPS for information and opportunities. So we're about to meet Hannah. Hannah's a nurse. Nurses represent about 8,000 employees out of our 32,000, so they're pretty important. And what we know about our nursing groups are that, in essence, when you start as a new nurse, it takes you about 2 years to get comfortable with providing care, of the reality of providing care. And after about 2 years, what we find is that the nurses are looking for, at least some of them, looking for something else, looking for that next step in their career. 2, 3 years, maybe, but what we find is that that's that point in time. So let's meet Hannah. Hannah is a new employee to BJC, and she's coming in the door with 3 years of experience, which makes her an incredibly valuable resource already. Already, we want to keep Hannah at BJC. She has 3 years of experience, and she's now made that transition into a critical care unit, which is a expected path for those nurses as they go through their career. So she works in the NICU, and that's one of a healthcare acronym for the Neonatal Intensive Care Unit. So she works there. She's just started in our pediatric hospital in the NICU, and she's working the night shift. What's important to BJC is that we reduce the turnover. Remember, 1 in 4, we definitely don't want Hannah walking out the door. So we want to keep her by connecting and engaging with her early and often. And then we also want to make sure that she understands we have things to offer her throughout her career. Here's Hannah's roadmap. We're going to go on this journey, and you're going to see the leader perspective come in at these same points in time. Onboarding, 6 months and 2 to 3 years. So Hannah's roadmap includes onboarding, making sure she has the tools and the information that she needs. At 6 months, to make sure that she understands what else BJC offers. And then at 2 to 3 years to see is she ready for the next step. So Hannah comes in to our portal. We have SABA as our integrated talent management system, and everything that I'm going to show you from here on out is delivered within SABA as our portal. You'll notice at the top right, well, my other right, or the left, there's a compass rose that says myGPS. So that's the entry point to this roadmap. So when she clicks on that, she sees the roadmap, again, organized over time. So up at the top of the journey is onboarding. And so what Hannah is going to do is she's going to click on that. But you'll see right underneath it is success in current role. As I scroll down, it'll be success in future role and then planning for retirement. So she clicks on the onboarding website, and it opens up with additional tools and information for her. There's a new employee toolkit. She's going to click on that. When she opens that, she gets helpful links, documents that she can open up to remind herself of benefits because she was a little overwhelmed during new employee orientation. She sees that there's a document that shows her all of the alphabet soup that makes up healthcare and BJC, so she can look at what those acronyms mean. This is a way to give her access. Remember, she's working the night shift. So that access can be if she's got some downtime at 3 a.m. That's fine. So this is her entree to onboarding. Now, fast forward. Hannah's been here 6 months. 6 months in, she gets an automated email, and that email is to remind her of all of the development opportunities that BJC offers to her. You can see that we have tuition assistance. There's a direct link if she wants to go in and look at the academic partnerships that we offer. It links to my department, the BJC Institute for Learning and Development. So that email is there to jar her memory about those benefits that she learned about when she first started. You'll see later on, when we go in through the manager point of view, that her manager gets a similar email. She's here, she's 6 months in, she's got her feet underneath her, but she's struggling a little bit because, again, she works in the NICU. That NICU has babies that you can hold in your hand, and that can be a lot of stress. So she's struggling a little bit. She's working the night shift. She's not thrilled about that. So she's looking for something. She has a conversation with her manager. Her manager says, hey, let's go out to GPS. And together with this conversation, they look at success in current role and they see that there's a link to resiliency. And so Hannah says, hey, that sounds great. So she takes a resiliency class, and she finds some techniques that are really helpful to her. So helpful to her that she decides she wants to be a champion. A Resiliency Champion is one of the programs that we offer at BJC. And this is a grassroots effort that gives a champion some tools and techniques and activities to run within their own groups. So she can do this for her teams and staff meetings and things like that. So now she's feeling like she's pretty well connected. 1 year in, she's got her job under control. She's looked into some of the development opportunities, and she's a champion for the resiliency program. Fast forward again. Now Hannah's been here 2 to 3 years. And now Hannah's going, I think I might like something else. So she goes to GPS, and now she's scrolling down into that success in future role. And within the success in future role, we have our career services, we have our academic partnerships, we have leadership development. So as an emerging leader, she can learn how to participate in those things. So she's in GPS, she goes into the career services website. And the career services website has all sorts of self-directed resources. We offer workshops, and we offer an interactive career map. So she downloads the self-exploration workbook, and she decides, you know what, I might look to advance in my nursing profession. So she's thinking about that, and her manager, again, in another conversation says, hey, let's go out to GPS, and let's look at the career exploration map. So this map is organized by job family and by role within each family. So in this example, she's exploring what a nurse practitioner does. And over on the left, you'll see there's a job description, educational requirements, and she sees that really she should have a Master's of Science in Nursing in order to become a nurse practitioner. So there's a link she can click on, which takes her to the academic partnership information. BJC offers a whole slew of offerings, academic offerings through the colleges and universities in our area. And so she can take an online orientation. Again, this is all collected together within the SABA environment. She can take that and signs up for a master's degree program. And that's Hannah's story. Next point of view that we want to switch over to, and remember we're going to go down that same road just on the other side. We're going to take it from Frida's point of view. So meet Frida. Frida is the manager of the NICU. She's got 30 other people that work for her. 30 people who are on different points of that road. Some people may have been here 5 years, some may have been here 10. Our pediatric hospital has low turnover, so it's likely that they've been here 20 years or more. So she needs to be able to use GPS to meet people where they are on their own journey. Focus for us in the Learning and Development group is to support Frida, to give her those tools and those support documents and videos and supporting materials at the point in time when Frida needs it. Same time frame that we're going to visit with Frida. 6 months. Well, first we'll start with onboarding. We'll go to 6 months and a year, and then we'll end up at 2 to 3 years along the journey with Hannah. So Frida also goes into our SABA instance. She clicks on myGPS. Notice it's a little different This side is really, again, about tools and resources. So she, in that first section, that top section, she can find selecting new team members, so she can download an interview guide, or she also has specific tools that relate to onboarding employees. So she clicks into the Onboarding Toolkit, and she actually has email templates that she can use. And this is just an example of what she might find in that set of tools related to onboarding. So she knows in this that what is important, because she wants to keep Hannah. This talent, especially the nursing talent, is really, really hard to find. So she wants to keep her. She's got 30 other people. So by using these templates, it gives her a framework in which to use so she doesn't have to reinvent the wheel. Now, it's not a template for her. It's not a script. It's just some guidelines of things to use to connect with her. Fast forward. We're now at 6 months. Hannah's feeling that stress, remember. Frida's looking to support her. So Frida goes on to GPS and looks at how can I support my team? She goes into the leader side of resiliency and says, hey, I could suggest this for Hannah, which she does. Also, at 6 months and again at a year, Frida's going to get a similar message that Hannah received at those points in time. And she's going to be reminded of all the things as a leader she can offer to Hannah to make sure that Hannah feels supported and engaged. She's got career growth. It talks about that career map that I just showed you. It talks about other opportunities. This particular example, this template that you're seeing, is the one that you get at the 1 year mark. And at 1 year, you get certain things available to you. Like you can apply for a transfer or promotion, move into a new role. You also get adoption assistance and other benefits. So this is Frida's reminder that she has these things to talk to Hannah about to make sure Hannah feels comfortable, supported, and wants to stay. Fast forward again, 2 to 3 years. So now Hannah's said, hey, I'm ready for something new, and together they're sitting down with GPS, and Frida's using her side of the map to say, ooh, what are the emerging leader programs? Hey, let's look at that career exploration map. And so she's continuing to challenge Hannah to help Hannah think through her own development. But again, she's got 30 people, so she can use GPS for any of her other team members as well. That's the journey from the employee and the leader. Let's take a look at what we need to think about as administrators of the program. Communities. 2 things in SABA. One is called the workspace, and those, in essence, it's a custom page. We also have groups. Groups allow us, with the workspace, to create a different environment for GPS depending on who they are. So the group says only leaders have access to leader GPS. Iterative communications. Iteration has really been a great tool for us. We push out GPS every quarter. We update, we enhance, we roll out new things. And we share those quarterly with our HR leaders and our HR business partners. They are great partners in pushing out what we have. Feedback loops. Ooh, people in healthcare are not shy, and they will tell you what's working and what's not working. And so we've got a lot of different methods for allowing feedback, including links within the GPS tool. And then we have partnerships. We partner with our HR group. We partner with our IT groups. We partner with marketing and communications, and we even have some external folks helping us create custom things like micro apps. Iteration, I told you, GPS in essence is a framework. That's what it is. But we know with the iteration we can fail fast, and what doesn't work we'll know right away, and we can pull it back and push it out next quarter or do a bug fix. We have a roadmap ourselves, and we know, for instance, we're pushing out a new development plan tool. That's part of career services. That's an iteration. That's a release of GPS. Find our experts. Guess what? Resiliency is a grassroots effort. We have so many people who have gotten included in that champion program, and they're all bubbling up content on their own. The groups and the workspaces allow us the ability to secure that site so people can upload if we allow it, and or just read only. And then don't run out of gas. That's a note to me. It's sometimes just to look backwards to make sure that you realize how far forward you actually have come. We've gone through our journey. We're doing performance and management right now. We're doing talent management next year. We're doing development plans about me, talent cards, all of that. I really want to make sure that you understand that one thing that you can do is you can use your own creativity to help organize things in your own metaphor, within your own system, because you do. You have that capability just to create that framework. And what happens is it makes it user-friendly and accessible. So thanks for coming today. I really appreciate your attention.